Committee on Education and Labor will come to order. This hearing is an important opportunity to discuss the Department of Labor's budget request for fiscal 2020, as well as many other important issues under your jurisdiction. Mr. Secretary, for too long we've acted as though the growing economy means that what is good for the economy is inherently good for all workers, but evidence and experience demonstrate that benefits of economic growth are not being shared by all workers and their families. A really strong economy exists only when everyone is succeeding.
The budget is an indication of what you believe is important. So if you're cutting workforce development, you don't think workforce development is important.
Congresswoman, the amount of time and energy and effort that this administration is spending on workforce development.
How much are we spending?
I believe I said the amount of time and effort that this administration is spending, because we shouldn't judge success merely by dollars, but also by time and by effort.
You can't judge it by dollars, but if you're going to cut 40% from Job Corps, 16% from other employment opportunities, then time and effort is nothing. It is talk. It is not action. We need young people to have an opportunity, especially children who are homeless, children who are in difficult situations. You want to protect kids? Then help them. Don't cut their budgets.
Mr. Secretary, the fact remains that we once had 60% of Americans protected and eligible for overtime, and we only have 9%, and you're only proposing to increase it to 15% of the salaried workforce. I don't think that that is a Secretary of Labor that's protecting the American worker.
For women, reproductive health care is health care, but your department has issued rules that deny the science of women's health care and allow employers to deny workers health insurance that covers contraceptives. Despite the fact that the courts have repeatedly blocked these rules, you and this administration are continuing your efforts to deny women contraceptive coverage. I'm curious, do you know how much on average contraceptive costs for women if it's not covered by their insurance?
Congresswoman, I certainly am aware it is expensive and the price likely will vary.
Okay, so if you want to just make a best guess, what would that be?
Congresswoman, I don't think it's appropriate to speculate.
Do you know that women use contraceptives not just to prevent pregnancy, but also to treat medical conditions?
Congresswoman, I'm not a physician.
Just for the American people to understand what we are outlining, these short-term limited duration insurance plans are not required to cover pre-existing conditions. They are not required to cover prescription drugs. They're not required to cover maternity coverage. And no, they are not required to cover inpatient hospitalizations. This administration has been relentless in its attempts to undermine access to health care. In nursing school, we are taught how important it is to listen to our patients, and instead of listening, this administration is ignoring patients and nurses and doctors. The administration is not protecting moms or kids or people with pre-existing conditions. It's attacking them. And let me tell you, sir, not on my watch.
On the minimum wage, the White House economic advisor stated, and I quote, "My view is a federal minimum wage is a terrible idea, terrible, and will damage particularly small businesses." Is that the position of the Department of Labor?
Mr. Chairman, about 3/5 of the states have passed a minimum wage that exceeds the federal level. It's our view that a federal minimum wage would be those 3/5 of the states imposing a cost structure on the remaining 2/5 of states that have chosen not to increase the minimum wage above the federal level.
The quote was that a federal minimum wage is a terrible idea. Is that the position of the Department of Labor?
Mr. Chairman, we do not support a change in the federal minimum wage at this time.